Hi, good morning, everybody. I'm so glad you're here. My name is Kristen Snowden, and I'm a licensed marriage and family therapist in the state of California. Okay, one of my questions is Kristen, my husband confessed his infidelity on his deathbed. My first grief counselor told me to put the past in the past regarding his sex addiction. Um, Obviously, I do not need any couple based therapy as my situation is unique. What would you suggest for someone dealing with grief and betrayal? And I was going to say, there's several people I've encountered in my betrayed partners work that have a similar story, which is why I've created two separate groups. One is a processing grief and loss after betrayal, because there are a ton of grief and loss issues that occur. The other group that I created is healing on my own. And I know other therapists and again, sex and relationship healing.com, they have groups specifically for betrayed partners who are not continuing on the healing recovery process with a partner. Sometimes it is because they've died, and sometimes it's because they've divorced and left. But I actually find those two cohorts do blend well, and kind of support one another because they kind of offer different perspective. But those are the two types of groups that I think would be helpful for you, or to do betrayed partner based groups that are processing grief and loss issues, or are a cohort of people who are not continuing the process of being with their betrayed partner and they're continuing on alone. Um, because I think there's an importance of needing to understand posthumously, which is hard. What your partner did, because there's always these questions of, well, what was the nature of the betrayal and how often and for how many years, and was our entire marriage fake or a giant lie? So getting a lot of education on understanding what is addiction, what does it tend to look like, writing out a timeline to the best of your ability to help answer these questions posthumously to the best of your ability. Um, and then really getting in touch with what happened, like why my body feels so betrayed, so traumatized, so confused. And betrayed partner sensitive therapists can usually offer you a lot of education on that, and then you'll also hear from the other betrayed partners in your group about what's going on for them to help you with those issues. A comment regarding ACA. I credit ACA with helping me focus on my own recovery, learning to set boundaries, and overall healing from dysfunction. This person says they highly recommend to all betrayed partners. And also to just be careful to help you understand. It's not saying that because you grew up in a dysfunctional situation, you're this like co-addict, messed up person that also needs to fix up your relationship dynamics. What I think it is helpful to do is to just help put names and patterns to what's been going on, because you've been living with and loving an unknown addict for so many years. And it really just helps you understand like how your partner, your addict partner, had emotional dysregulation, how sometimes betrayed partners without knowing would take on what we call the fawning response to kind of just keep the peace in the household, things like that. Next question. What is a reasonable amount of time for the waffling of should I stay or go before it becomes apparent that the partner is stuck? Do therapists have techniques to move a partner out of stuck? So I have two videos. One is should I stay or go? Questions to ask that I use with partners when they're stuck, and reasons for why you might be getting stuck. So those are two separate videos, and those will answer exactly those questions. These are things that I see about why someone gets stuck and ways to try to move out of that stuckness. And the other is really important questions to ask, to journal on, to process in your groups, to process with your therapist about should I stay or go, things to consider. How do you approach working with a therapist who feels Dr. Minwala's model is too shaming? So I said specifically, I feel like Hope Ray's and Dr. Minwala's models are really great for the betrayed partner to understand what was going on in their experience in their body, how your partner's addict behavior and the lying and the hiding, the subterfuge of it all, how that showed up in your body. Um, there's a lot of reports from, like, for instance, people that work in sex addiction treatment, that the ego strength, that sex addicts have such low ego strength and low tolerance for hard conversations, that really big strong words like partner addict violence and integrity abuse disorder, those do feel very blaming and shaming to them. I'm sorry, not blaming, but just shaming. So I usually start when I'm working with an addict, um, with understanding what kind of words and semantics feel safer to them. Um, to try to point out the lying and the manipulation and the emotional abuse and how scary that is for a person, like me using that grocery store metaphor, that doesn't tend to be shaming for someone. And it kind of just helps them understand and see their partner from a different view. So I'll use my own stuff to kind of figure out what if I'm working with an addict or a coupleship with an addict in it, one of my first goals is to meet them where they're at and keep them coming back. So there has to be a level where I'm developing a rapport with them and I'm meeting them where they're at with their ego strength and their ability to talk about hard things and slowly kind of push them a little bit more, challenge them a little bit more, add in some more material, some different words that are kind of harder to say or swallow or or come to terms with the fact that they've been capable of doing such harmful, hurtful behaviors. And that's how I tend to handle the shaming stuff. My husband is finally willing to do marriage counseling. However, he refuses to do any therapy for himself. Is it even worth us doing marriage therapy without that? He is an alcoholic in sobriety, porn addiction with infidelity, video game addict, nicotine addict, and he recently dropped most of these addictions through doing a lot of work on himself without outside help and minimal AA. I believe he has ADHD and possibly bipolar, but he refuses to go to a therapist for these issues and thinks he can heal himself. What's the best way to move forward with therapy for our marriage to address the 20 years of betrayal? Um, right. The words you're using are leading me to believe that there's still a lot of denial and minimization. And what we call the big keywords I use for saying this is someone who looks like they are actually embracing real recovery is my two big words are humbleness and surrender. You can't heal something that you haven't identified as a problem. So I am a sex addict, I am an alcoholic, but the big piece of the 12 steps is saying, and I'm powerless to these behaviors. My best thinking and my coping skills and whatever, my flaws will lead me back to these behaviors time and time again. So I have to ask for help and get help from my fellowship, my community, my AAA group, my SAA group. They're also going to be the ones that are going to call me out on my, I'm a unicorn, I'm a unique story. They're going to call me out on my lack of empathy. They're going to call me out on me minimizing behaviors or kind of being sneaky or shady. These are all things that I need to show the capacity to do empathy, lean into someone else influencing me. As I say, it's like living in consultation, owning, surrendering the fact that I make poor choices and I need somebody else who's shown the ability to stay in recovery. And I'm going to do what he tells me to do because he has 20 years clean and I don't. So there's lots of demonstration here in this story that you've shared that there is no humbleness or surrender in this person. Maybe not. I don't know. But that is probably not going to be someone who's going to be able to show up with empathy and compassion when you're trying to help them understand how the lies and sneaking around have harmed you and what you need to feel safe, because it doesn't sound like he's doing the things that you need to feel safe. I mean, I guess you could talk about it in couples therapy, but just kind of more call everything out for what it is. I don't know if you're going to be able to do repair things. Next question. How do CSATs assist with the addict getting out of denial and learning empathy? Do they lead with the addict in a homework treatment plan type way, or just wait until the addict brings up the needs or idea? So hopefully from the question I just answered, you'll find that I personally believe a lot of that dealing with denial and empathy development happens in groups from other addicts and other addicts who have good recovery, other addicts who are like, hey, you're not a unicorn. I've done variations of what you've done, and I still am in recovery, living a life with honesty. So I think CSATs can definitely help. Yes, they do use workbooks. I think a beautiful combination would be I've heard of great CSATs who have both like men's groups, men's sex addict groups, and they'll see them individually. When I ran the men's drug and sex addiction program, that was a really great combo because I could do the work, the educational group work with them, hear them in a group setting, have them challenge and kind of poke and annoy one another and engage one another and maybe potentially hopefully bond with one another. and then be able to take that exact material that I witnessed in a group setting and then do individual work with them as well. That is what I find to be a really effective dynamic duo. So if you can find that where they have run both men's groups and do individual therapy, that's great. Um, how about partners stuck in thinking that they can fix or help or guide their addict into good recovery, or stuck not focusing on her own healing and completely focusing on his? Um, well, first of all, I feel like it's a very, very normal thing that when you've been traumatized by your partner's, behavior, that's you're so blindsided by it. It's such a loss of control, and there's so much powerlessness to like living with and surviving on at the whims of a person where they can kind of do anything and everything. So I want to normalize that trying to control your partner, go to the meetings, see your therapist, read the big book or all that kind of stuff. Are you finding the right therapist? Are you going to your men's meetings? Are you doing your steps? What step work? What are you saying in therapy? Those are all very common responses to being in a state of trauma, trying to control. Um, so it's delicate in a partner sensitive therapy environment. There will be regular discussion about that. It'll be validating and understanding why the betrayed partner does these behaviors, tries to control their partner's recovery, but kind of pointing out the insanity cycle of it, right? We talk a lot about insanity in addiction recovery, doing the same thing over and over and over again, but hoping for different results. There's a lot of addicts will go into recovery to check it off the box, as we call it. It's consequence avoidance, so she lets me back into the house, so she doesn't file for divorce, um, to stop her nagging. That ends up just being that consequence avoidance. An addict will only do, as we call it, soulful change, real change in below their chin. They change their heart, change their framework, change the way they cope with things in life, understand the harm they've caused, all the things that going through the 12 steps helps you explore. That all has to be done on their own. And the best thing betrayed partners can do is create a consequence structure with the help of their therapists of, what do they need to feel safe, and what kind of things help them or cause them to not feel safe, and what kind of steps do we need to take to regain safety. That's kind of more the framework that I try to help them shift to. After I've graduated from my CSAT, we've graduated from couple CSAT, but betrayer is still continuing CSAT work. Should I expect routine updates from his therapist so I know he's not conveniently leaving out details of his therapy that I should know? I don't think he's lying, but I don't feel I have the same connections to his recovery work as I did when we had 3 CSATs. But of course, can no longer afford 3. I know, I acknowledge it's very, very expensive. So specifically, when betrayed partners ask me this question about my partners with a therapist, and I want to know what the heck they're talking about, the first step is always to just ask the partner, what the heck are you guys talking about? Are you willing to share? Are you willing to do those check-ins? They'll have those weekly Thanos check-ins kind of thing. If that doesn't go well and you still are like, well, I don't think my partner or my partner's therapist really understands what's still going on here. Maybe he's not relapsing, but I'm seeing like some maybe kind of lying about silly things or procrastination. And these are all tied into his like acting out behaviors. And, I want to talk to somebody about that. These are 2 options. I always say there, confidentiality is between a therapist and the patient. So I can never go tell you the contents of my therapy sessions with a client. However, there's no rule against you writing an email to me and just telling me what you're seeing at home. Again, because I'm more about openness and transparency, I would let the addict know I'm sending an email. Just so you know, I'm writing this email to your therapist and I'm sending it. You're welcome to see it, but I want him to know I've sent it. The other option is to talk to your addict partner about how do you feel about me coming in once every 3 months, or every 2 months. I don't know, whatever makes you feel safe. Where again, it's not about me finding out what you guys are talking about. Maybe, what you're talking about is your thing, it's your work, it's your recovery. But I just want an environment where I can show, I think a lot of betrayed partners always live in fear of being made to look like the crazy person back home. And so I think there's a lot of draw to them wanting to show this therapist who doesn't know them, like, hey, I'm a real human being. Like I'm trying, I'm struggling, and yeah, I lose my temper and I can be controlling and I sometimes throw things, but like I'm a human doing my best. And so sometimes it's just about that kind of, showing face in a therapy session. Some therapists will be like, no, absolutely not. The therapy relationship is coveted and I don't let other people in. I've personally had, anytime I'm working with an addict, I always know there's another version of the story. So I always invite them in as a guest. They are not my therapist client. They are a guest coming in occasionally, again, once every 3 months, once every 6 months, depending on the need, to help the person get to know me or get to share something that maybe they find would be helpful to me in the therapeutic process. Last question. Um, Someone said something about CSATs, no secrets. Yeah, it's because you've been damaged and hurt by secrets. So I don't hold people's secrets. If I'm seeing you both as um clients, we'll have maybe separate sessions, but you we will engage appropriately what the content of those conversations have been. That's for a couples therapy type of relationship. There aren't many options for CSATs in our area. My husband is willing to switch from a CSAT now to another CSAT that is more structured with groups as well. I'm nervous about going to see his current CSAT because I worry what lies he has told about me, us, what impression she may have of me and us going in that will not be helpful to my healing. Am I overreacting to this? I know I should have, but I have not met her as yet. I mean, there's no shoulds in this process. I can only just tell you recommendations or general protocols. Um, but I'd say let her know that. Hopefully she gets the fact. I mean, that's like the common thing that addicts have is there's minimization, rationalization, justification, and all of their behaviors. And one of their favorite scapegoats is their partner. I went out and cheated because she kicked me out of the house. That she nagged so much that we weren't having sex anymore after our kids were born. So it's very common for CSATs to know that their partner, their addict partner, will pose them in a certain way. But yeah, that's why it's important for betrayed partners to go into session every once in a while, just to meet them, to share who they are, to let them know what's going. Like again, any information that betrayed partners think a therapist might need to be more productive in their process. I find it helpful. It's more information for me as a therapist. For all things. Again, that's why I think group therapy or again inpatient treatment therapy is so helpful because I don't just see a client one time a week, 1 hour. I'm seeing them in a group setting, them engaging in communication with another person. What stirs up feelings in them? Who pisses them off or upsets them, or who do they feel bonded to? How do they react to other people? That is all helpful information to me when I'm trying to treat addicts. And that is it. So I think that is all, everybody.
Thank
I
you,
appreciate,
Kristen.
yeah, thank you. Always enjoy these, and I love WeTonglen. Thank God it's here. It's free, accessible. So, um, I have my email, Kristen Snowden, mft@gmail.com, my website, kristensnowden.com. Hit me up with any other questions that you might have.
Thank you. And you're
Thanks.
always welcome back anytime.
Okay, all right, thank you. All
Have a good day.
right, bye.